Remembering the victims of COVID-19, a memorial was held outside the Rhode Island Department of Health this afternoon for the nursing home residents and caregivers who lost their lives to the virus. 12 News reporter Rob Nesbitt was there for the memorial and joins us now with more.
Those who attended the memorial say that staffing issues at nursing homes started long before the pandemic. They believe legislators have the ability to fix it.
We remember the residents and workers in our nursing homes.
While friends and family gathered in a circle outside the Rhode Island Department of Health,
Brentwood Nursing Home.
The number of deaths in each Rhode Island nursing home,
10 to 14 deaths,
were read out loud. Vicki Moss and her family attended Thursday's memorial to honor her mother, Dorothy.
After she passed, we found out she was now testing positive, and that was the cause of death on the death certificate.
There have been around 800 resident deaths in nursing homes since March, according to Raise the Bar, the coalition that organized the memorial.
80% of the 1,000 deaths in Rhode Island are in nursing homes. And I wanted to make sure that there was a face attached to the tragedy.
The family also felt it was important to show their support for those working in nursing homes.
We need the staffing and we need it now.
Adelina Ramos tested positive for COVID while working at a nursing home in Greenville. She says 9 residents there have died of the virus.
We are afraid to bring it home to our family, but we still have to go to work every day and take care of these residents because they need us at the end of the day.
To help nursing home workers, Raise the Bar pushed for the Nursing Home Staffing and Quality Care Act to pass in Rhode Island.
Now is the time to take action.
That legislation would make it so each facility provides a minimum of 4.1 hours of direct nursing care for each resident a day.
It has passed unanimously in the Senate. The House opted, instead of taking action, to create a study commission which has no power to affect any change.
to 24 deaths.
Maureen says that nursing homes will continue to have the most COVID-19 deaths in the state if legislation is not passed.
We're 46 residents to 3 CNAs.
The family of Dorothy Moss know just how emotional that statistic can be, unable to publicly mourn their loss until now.
So it was important for us to be here today to at least do that a little bit and get that taken care of in some way.
According to Maureen, there's no public record to show how many nursing home caregivers have died of COVID-19. Reporting in studio, I'm Rob Nesbitt, 12 News.